Welcome, everyone, and thank you for being with us here today. My name is Carrie Froome, and I'm the President and COO of Concordia Hospital. Again, I would like to thank you all for joining us today, and a special warm Concordia welcome to our Premier of Manitoba, Wab Kinew, Minister Asagwara. Our WRHA Interim CEO, Jane Curtis, is with us, Dr. Buchel, Dr. Toor, along with Carol Bijot, one of our first spine patients here for this new surgery at Concordia Hospital. So you're the reason this announcement is so important today. Also, so thrilled to have so many of our ministers and partners in government with us today. MLA Dela Cruz, Minister Schmidt, MLA Corbett, Minister Malloway, and also just joining us here, Minister Wiebe. So welcome to Concordia. So excited to have you here. Let's start by acknowledging the traditional and ancestral lands we serve on. So Concordia Hospital and the Winnipeg Regional Health Authority provide services to all nations on the traditional and ancestral lands of the Anishinaabe in Inawak, Anishinaabe, Dakota Ote, Dene, Inuit, and also the national homeland of the River Métis. Treaties were created with the First Nations and include past, present, and future inhabitants, so we all are treaty people. The Winnipeg Regional Health Authority and Concordia Hospital serve those on Treaty 1 and Treaty 5 lands. We acknowledge the 5 Dakota communities in Manitoba that are not signatories to any treaties with Canada, and we also acknowledge that Winnipeg takes its drinking water from Shoal Lake 40 First Nation. We acknowledge that the acts of colonization, which are part of our history, have caused deep, lasting harms which continue today, and we commit ourselves in a good way to learning about truth and reconciliation, promoting healing, and creating a better future for us all. Before we move to our formal program, I really want to take a moment to thank all of the staff here at Concordia Hospital for their continued hard work and dedication to providing the best possible care to all of our patients that we serve. Concordia has some of the most dedicated, compassionate, hardworking staff anywhere in the province, is my opinion. And I know that everyday lives are transformed not only because of our surgeons here, but really it's our unsung heroes working behind the scenes who did all this work to make this program a reality. We couldn't do a single surgery without you here. It was a full team effort from everyone from our purchasing department, finance, our procurement team, our medical devices reprocessing team, and we have some members in the back, so thank you for all the work you did, our diagnostic imaging team, as well, of course, our OR team, our recovery team, our educators, etc. So a huge thank you to you all, and the list is yay long. We are here today, though, to talk about an exciting and innovative surgery program at Concordia Hospital. And I'm very proud to say that we are helping lead the way when it comes to state-of-the-art equipment and technologies to perform these spinal surgeries. You'll even get a chance to take part in a surgery demonstration later on to see really how the surgery works and what makes the surgery so innovative and so wonderful and decreases the recovery and the surgery time. Anyway, to hear more, without further ado, I'd now like to introduce the Premier of Manitoba, the Honourable Wab Kinew.
All right, today we're making an announcement about giving many Manitobans their freedom back. Freedom to be able to lead a full and fulfilling life, the freedom to be able to spend time with kids and grandkids, and the freedom to live a great life right here in this province that we love so much. That's why we're here to announce $2.7 million to expand advanced spine surgery here at the Concordia Hospital. This cutting-edge, minimally invasive technology helps patients recover faster, with most able to go home the same day or the next day. And by adding this capacity here at the Concordia, we're helping the rest of the healthcare system too. This alleviates pressure at the Health Sciences Center. It brings care closer to home for folks in Northeast Winnipeg and its surrounding communities. And of course, this spine center of excellence that we now have at Concordia is helping to attract surgeons from across Canada and around the world to train here. So I think that we all agree that freedom of movement, not even necessarily the kind protected in the Charter, but just the freedom to be able to live your life, to get outdoors during the wintertime, to be able to walk to the store is a huge part of having a high quality of life. And being able to get more Manitobans back to that freedom more quickly is an investment that I think we should all be proud of. So thanks to the Conc and thanks to everybody who's made this thing happen.
Thank you, Mr. Premier, for those remarks and for your commitment to rebuilding the healthcare system. I'd now like to hand it over to Minister of Health, Seniors and Long-Term Care, Uzoma Asagwara, to share more details about this exciting announcement.
Thanks so much. Hi, everyone. Thank you so much for joining us. I see a whole lot of people in the back behind the scenes who I know are team members here. I want to take a second to shout you folks out and thank you so much for everything that you do. You play a huge role in how we got here. You're going to continue to play a huge role in how we move forward. So if we could just take a minute to say thank you to all those folks who are part of the team. So as the Premier shared, we're announcing $2.7 million in investment in minimally invasive spine surgery. That means that Manitobans are going to get the care that they need right here at home. This is fundamentally important. It means that Manitobans who have been living with chronic back pain are going to get that addressed right here in their own province, right here at Concordia Hospital. This is technology that really changes the game in terms of recovery. So folks are going to be able to go home same day, maybe the next day. It's more efficient for the system, but first and foremost, this is about patients being able to get home more quickly and recover in comfort. We know that this is part of a larger approach to us fixing healthcare. And we cannot thank the experts here in Manitoba who have been a part of getting us where we are today and who are going to help shape the path moving forward. That's all the frontline folks, but I want to take a moment to thank Dr. Buchel, who's been a wonderful expert and partner for our government and has a great vision for this province and how we can improve care no matter where you live, and Dr. Toor, who I had the opportunity to meet not long after being sworn in, and I knew right away this is a person with an incredible vision, great ambition for what we can do in this province, and I think that today's announcement really shows us yet again what we can achieve when we work together. It is a testament to the spirit and the innovation that's right here in our own province. So we also know that this is going to help address ED wait times. We know that it means patients are going to get care in the right place more quickly. And we saw earlier this week that we announced the new surgery clinic at the Grace. Those are folks who are going to be seen in a way now that will alleviate pressure on that emergency department. It means that folks are no longer have to go to the ER for post-op care. They get direct access to the surgical care and the experts that they need. And so now, in addition to that, having Concordia with the designation of the Spine Center, Surgical Center of Excellence, I think folks can see that all of these investments, all of this collaboration is really paying off for Manitobans. So I want to thank every single person who had a part in getting us here today. Let's keep working together to not only stand up more surgical centers of excellence in this province, but again, to make sure that no matter where you live, no matter who you are, you're getting the best care close to home right here in Manitoba. Thanks.
Thank you for that, Minister. Jay Toor, one of our orthopedic spine surgeons, was instrumental in bringing this instrumented navigated spine surgery program to Concordia Hospital. He has worked tirelessly to make this happen. He's very passionate about it, and today's announcement is really a testament to the hard work being undertaken by so many in our healthcare system. I'd like to invite Dr. Toor up now to speak more about these instrumented spine surgeries and how they impact our patients.
So thank you everyone for being here. I just want to first start with commenting on the impact of this to our patients, because ultimately that's why we're doing all these positive changes. So, one of the biggest impacts that this has had is we're now able to move moderately complex spine surgeries that were previously only being performed at HSC, out of HSC and into Concordia Hospital. So this is decanting and reducing the burden in our busiest center, HSC, and allowing us to focus on the more complex cases there. And then as for the surgeries themselves, for patients like Carol, we're able to provide the surgery that's the most cutting edge. These traditional surgeries before this technology was brought in were very long incisions with a lot of blood loss, higher patient complications. Most of the surgeries that are being done now on patients like Carol, patients are going home either the same day, the next day, versus they were staying in the hospital for weeks after. So it's had a lot of impact in terms of efficiency in our system. And then for the patients themselves, they had less pain. They're back to function earlier. Carol was climbing a mountain, shortly after her surgery. So that's and that's very unheard of after a spine surgery. So we're also very proud that this technology, this is not the best best technology in Canada. Worldwide, this is the best spine technology. As of now, surgeons across Canada who are already in practice are being flown into Winnipeg to test this technology, observe these surgeries. So they're not being brought to Toronto, they're not being brought to Vancouver, they're being brought here to Winnipeg, and we're doing these surgeries here. So I'd really like to thank the Premier. I'd like to thank the Minister of Health. This is a government that listens to frontline workers. About a year or so ago, I emailed the Minister of Health and I said, this is something that our spine program in Manitoba needs. They took our meeting, they met with us, we went over a plan for developing this program. Shortly thereafter was funded, and it's been 6 months now that we're performing these surgery. Carol was the first patient. So that's I don't know a jurisdiction in the world, I don't know a jurisdiction in Canada where a frontline worker like myself can contact the government, have a face-to-face meeting with the Minister of Health, and have something, rubber meets the road within a couple of months. So thank you very much. And I'd also like to thank Carrie. Carrie is the CEO of the hospital. Here with her at the helm, having a very proactive leadership, and we're able to get this program running very quickly. And Deputy Dr. Buchel, one of the major reasons why I moved to Winnipeg was recruited from Toronto. He's got a long-term vision here. He's made a tremendous impact in all of our surgical wait lists across all surgical specialties, and definitely spine. And I'd like to thank we've got some of the nursing staff there. There's a lot of people behind the scenes that make these programs happen. So we have device reprocessing, supply chain, and all the ancillary staff. So thank you very much for your support. And then most importantly, I'd like to thank our patients. So people like Carol, thank you for being patient with us. Thank you for your trust in us. Everyone here is making all the right administrative decisions, and everything is really trending in a positive direction. Thanks very much.
That's great.
See, I did say we have the best staff in Manitoba, so it's proof. Thank you, Dr. Toor. Absolutely, I echo your comments and thanking the Premier, thanking Minister Asagwara for making this important investment into Concordia and into the patient care that we now can provide here. I'd now like to invite the Provincial Surgery Specialty Lead, Dr. Buchel, to speak to us about the impact this new equipment is having on our healthcare system.
So these announcements are super fun for us because it shows that we're moving forward. We're delivering more care to more patients in a more timely fashion. So I'm super happy to be here to talk about this expansion of the surgery program, specifically related to spine at the Concordia Hospital. Some of you may remember about 2 years ago, the government made a huge announcement of the Provincial Spine Clinic and the Manitoba Spine Program being developed. That is part of the vision of a comprehensive care network for spine. It takes a group of people at HSC, our surgeons, our nurses, our physios, our occupational therapists, puts them into one site where we can funnel in all of the patients from all of Manitoba and deliver care where it's most appropriate. This is one very important step in developing the spine program for Manitoba. So the equipment you see here today was brought to HSC in 2024. We've now expanded that to Concordia, but it's more than just these new technologies. Whenever we are expanding, we want to use new technologies to give us more timely care, to utilize the best equipment so that we can actually decrease all of the pain, the suffering, the wait times that we've heard about being decreased for everybody in our province. We are providing more surgeries, but we're providing better, more comprehensive spine care. Right now, surgeons have done more than 40 cases utilizing this equipment at Concordia so far and are on track to reach approximately 75 new surgeries of this type at Concordia alone. Concordia has seen a 115% increase in their spine surgeries since 2019. From January to February of this year, Concordia has delivered 34 spine cases and on track to deliver more than 200. Remember that in 2019, they were delivering approximately 60. So we're going to be looking at a significant increase in spine care at this site. Not only more spine care, but better spine care. In our province, we are now going to deliver more than 1,000, or we have delivered more than 1,000 spine surgeries in 2025. That is significantly more than 2019, 30% more than 2019 for our entire province. So expanding Concordia Hospital not only treats more patients at Concordia, but as we've heard from everybody here, is part of a cog in the wheel that treats more patients in our province. It decants from HSC. Why is that important? We need to prioritize what we can do at what sites in the most effective way. Our emergency room at HSC and many emergency rooms are seeing a huge number of patients. To get those patients out of the emergency room, we need to treat them. The more complex cases stay at HSC. We decant to Concordia anybody we can that can have surgery done effectively here. That helps patients, that expands Concordia's footprint, that decreases the pressure on HSC, that decreases our wait times at the emergency room. That is the same thing with the Grace Clinic that was done. All of these things are done so we improve our patient care and improve and uptick our patient flow through our emergency rooms. The investment is bringing this new technology to Concordia. It means that surgeons, as Dr. Toor said, come from all over Canada to see this. But this is super important for recruitment. In the last 4 or 5 years, we've doubled the number of spine surgeons and we continue to increase them. Why? Not because of the weather. It's because we continue to build capacity. We build up our healthcare system so people want to come here. I've said this a million times. The reason doctors and nurses want to deliver care is because we enable them, our government and our system enables them to deliver great care. We just want to be able to say yes. This is saying yes to many more patients that can have their surgery in a timely fashion with the best equipment. This equipment allows us to recruit, keep our surgeons in our province, recruit new surgeons, and train our medical students who are from our province on the best equipment so they want to stay here. We're investing in medical students, we're investing in surgeons, we're keeping our surgeons that are here, also we can deliver more care to our patients. This is super important as we develop an infrastructure throughout all of our province. Again, this is very much part of our collaborative approach where we look at our sites delivering care, our spine clinic, and our spine program. It incorporates care and collaboration between physiotherapists, physician assistants, surgeons, nurses, and other healthcare professionals. Through this collaborative approach, we manage and coordinate wait lists to ensure that everybody is treated in a timely fashion. We continually struggle towards our goal that nobody by 2030 will be waiting outside of targeted wait times for anybody in our province for any surgical care. This is one step along the way. I would really like to thank the Premier, the Minister, Dr. Toor, Concordia, the foundations, and everybody involved. And when you look at how many people are involved, this is a team-building exercise for our province, and it has real outcomes. Thank you very much.
Thank you, Dr. Buchel. We're very appreciative here at Concordia Hospital for your work in helping add this critical surgical capacity to the system and for bringing this much needed equipment to our center. Thank you. So this now ends the formal part of today's event. We do have a very exciting demonstration, a hands-on demonstration planned for those who are brave enough to partake. Maybe some second careers for some people in the way. However, before we get started with that, we do want to open up the floor to any questions, and I'll just step back for that, please.
Sorry from interrupting.
Yeah.
Could you describe in detail how this machine works? I understand a demonstration like you talked about.
Yeah.
In advance, could you describe it?
All right, so traditional spine surgery, so there's anatomic structures in your spine where we have to put metal screws, basically metal screws, and I'll show what those screws look like. Traditionally, to see those screws, you had to make a very large incision, and you have to directly visualize them. So it involves making a big cut on a patient's back, removing all the muscle from the bone around your spine, finding those structures, and then putting screws in them directly. With this equipment, we position the patient on the table. This big C-shaped machine behind me that we have here, this is brought in, and it performs an intraoperative CT scan where I can essentially have X-ray vision inside the patient's back, and I can now make tiny incisions just a centimeter long. It's a little bit of a time-consuming process, but allows me to not dissect away all that tissue and just place those screws directly through the skin, and it saves that big dissection step.
Yeah.
That's really cool.
When surgeons come here from elsewhere to check it out, what do they say?
Well, they're obviously very impressed with the equipment, but what's more, you can put that equipment at any site, right? It's very important that you have the workflow around it. So especially like Concordia here, our efficiency in terms of our nursing staff, our device reprocessing staff, all of this is very dependent on a lot of teams. So our diagnostic imaging staff, they're very used to the workflow. So they're very impressed with how cohesive the team is in terms of executing those surgeries. Because you can put that in a site that doesn't have that cohesiveness, and you're not going to be able to have the same throughput rate through the system. So at Concordia, the efficiency is very high because we have all the diagnostic imaging team, we have the device reprocessing team, the nursing staff, everyone is just working together very well.
Can you provide a comparison, say who would get spine surgery at the HSC and who would get spine surgery here? Like it's more involved there and complex, but can you just provide an example?
Yeah, so probably the best example is if someone was involved in a car crash overnight, it's a 2 a.m., middle of the night spinal cord injury, they'd be done at HSC. So we want to focus on that complexity level at HSC. We can't bring that here to Concordia. Concordia is primarily elective surgeries.
Could Harold comment if there's an opportunity about our surgery and climbing the mountain?
So let's talk about climbing the mountain. Yeah, how you did.
Well, just the recovery time was just amazing after the surgery. I wasn't really sure what it was going to be, but it was very quick. I was back, it's been a year, not quite a year, and I was climbing a mountain at Christmas. And that's so.
Jeez, that's
Which mountain?
Oh, in the Lake District in England, Skiddaw.
How long have you had spine issues? What can you talk a little bit about that?
Well, I had sciatica and it would shoot down my leg and across my foot. So then literally the pain was so severe you couldn't move. You had to just not do anything for a while. So I'm totally free of pain, no pain whatsoever now.
that's
which is just. Sorry?
How long have you had an issue with sciatica?
For a number of years.
And how long until you became pain-free?
Actually, very quickly. The pain was gone as soon as you, basically once the surgery was over, and that the pain would always be there, even when you're sleeping, it would be just a constant ache, but the shooting pain would be what would come and go. But after the surgery, the pain was gone straight away.
How did the pain impact your life, like day-to-day life? Like what?
Well, it stopped you from doing a lot of things because you weren't really sure how you'd make it through the day, and that, so you may want to go and do a hike, but you couldn't because you knew that there's a possibility you may not be able to get back from that hike, and that you'd have to just sit there and wait, or just wait till you could get someone to come help you, and that, because when it pained, it really pained.
And you were the first patient to have surgery
At this hospital.
Yes. And did you know that? Were you nervous about that? What did they tell you?
Well, Dr. Toor explained it very well, and I had confidence in him, so.
Good job, Carol.
Yes,
Nice
Carol.
job.
Thank you.
Just to be clear, this facility is this machine is also at HSC?
Yes.
Yeah, okay. And there was talk of having a decant clinic open in January.
Yes.
Did that happen?
Yes.
Can you explain what
At
the
this-
decant clinic is?
Sure. So many patients, again, this is flow through our system, and we develop the capacity to deal with patients acutely and electively. Flow through our system is limited by the ability to put someone in the emergency room and then take them out and deliver care to them. But we need them to be seen by our physicians. So the spine clinic that was established 2 years ago is now expanding its capacity to pull people immediately from the emergency room. They come in, they have severe pain, they can't walk, they can't pee, et cetera, and they don't need to be in an emergency room for monitoring, but they need to be acutely seen by a spine surgeon. So we now can pull them out of the emergency room and say, go directly to the decant spine clinic. They will see them the same day, get expedited imaging, and then determine surgery, no surgery. And then we triage based on what we have. So we've cut down the wait time from sitting in the emergency room sometimes for a day, sometimes longer than a day, to saying, you're stable, you can go to a clinic, and we have now developed a clinic for you to go to. And now you get the expertise of Dr. Toor and the physios and everybody all together, one site to say, imaging done, CT scans, MRIs of the spine, surgery or not surgery, and that is an expedited process that's now shaved weeks, sometimes months, off the patient's wait, and many, many hours, sometimes a day, in the emergency room.
And that opened in December? Yeah.
That opened several weeks ago, 4 to 6 weeks ago.
So this is the second machine that is in Winnipeg. One's at HSC, one's here.
The two sites have them, yeah. We have some redundancies in the machines.
And so is Carol the first patient here in Concordia? Yes.
Correct.
You mentioned doubling of spinal surgeons.
Yeah.
I'm sure there's other disciplines that would also want doubling of surgeons.
Yeah.
Why are we having more success in I guess, spinal than maybe in hip or knee?
I wouldn't phrase it that way. I'd say that we've been able to recruit 3-4 very good spine surgeons to expand our program while we expanded the footprint for them to operate in, the clinics for them to see patients in, and the technology for them to do that with. That is the exact same thing we're doing for everything. So we're doing the exact same thing for arthroplasty. If you remember, a year ago, new program at Selkirk developed. New program means new equipment, means I can recruit new surgeons. So we've recruited new surgeons for arthroplasty also. We have wait lists for hip and knee and shoulder that are really coming down quite substantially. So we're doing the exact same thing throughout all of surgery. We invest in the capacity to deliver care. The capacity to deliver care then drives my ability to recruit surgeons to our province, because they want to come, because they know they can say yes to the patient and deliver the care. And then we deliver comprehensive care packages in clinics with our ability to get centralized intakes developed. And now we're talking about a provincial program where we can be accountable to the patient and say who's waiting for what, where, and we now know where to put them. The family docs know where to send them now. Instead of randomly sending them around to every single person, no, you can go to the Manitoba Spine Clinic, and they will take care of the patients for you. It's better care. It's coordinated care. It's a provincial plan. Yeah, well, they've decreased. As our numbers increase that we're delivering care, our wait times are decreasing. We developed SWIM, which is Surgical Waitlist Information Management System, which tracks our wait times. And we have the CAI data that's published every year about wait times in different areas. They collect data on the same patient population, but they report it in different ways. So wait times are very difficult to understand, but for a patient waiting, their actual wait times are decreasing month over month over month as we increase the amount of care we're delivering.
Neil? I would just like to add quickly as a board member here at Concordia, thank you, Carol, for sharing your story. And I myself have been for a long time waiting for a hip replacement. I know that impact of quality of life and our overall well-being when you're living in pain. And I thank our government for these kinds of investment that some people might say this isn't a big deal. It's a really big deal. And I'm so proud of this, and I'm so happy for you. And I'm happy that this is a program, not just, let's try to do something quickly, because within programs, we can measure that return on investment. We can track what did we want to do and have even better data to share the success of these impacts. So thank you for sharing your story, and thank you for the investment.
You want to go? We might have different topics. Okay. Yeah. Sure, go.
Go.
Again, unrelated to the announcement, but just the gas prices going up. Just want to ask if the idea of the gas tax one day has crossed your mind yet?
I hope this war in Iran ends. These gas prices are too high, and kids are being killed for no reason. Even the Trump administration cannot explain why they're at war in Iran right now. And I mean, like, the Epstein file seems to be as good of a reason as anyone else can figure out. So stop the war. So we're going to keep an eye on it. We're always going to be there to help you. We cut the gas tax once. We brought it down permanently afterwards. So we're going to be there to help with the cost of living. But right now, Donald Trump is public enemy number one when it comes to our economy and the average person keeping your head above water. So, yeah, that's my hope, is that the war stops.
How do you think this is going to impact the budget? I'm just thinking energy costs are up, it affects everything, and we've got a big deficit. Do you expect you're going to be able to balance the budget for the 2027 election?
That's our plan. You're going to see the best deficit number across the country on March 24th. You like that one, Ian? Yeah, you like that. I'm just teasing, ignore me.
On time change, I know you've talked about that a lot. But you did note something on the radio yesterday about saying that this could be the end or that we're nearing the end of clock changes.
Yeah.
Why do you think we're sort of nearing that point, and I guess what would be the next step?
Well, I'm sure everyone here has their own story about last weekend, but mine is that we were at the hockey rink for an 8:30 a.m. practice after the time change, and I was looking at the other parents, and I was just thinking, why are we doing this? It doesn't really make sense anymore. So I do think we're coming to the end of doing this time change twice a year, but the challenge is, if you look at the health benefits, there's a big comprehensive study in 2025 that modeled standard versus daylight. Everybody, I'm sure, intuitively would prefer the 1 hour of sunshine in the summer evening, but the health benefits are actually greater if you stick with wintertime, as it were, in Manitoba. So we're talking about prevalence of stroke, prevalence of obesity in the society coming down significantly if we move to that permanent wintertime. I just don't know if the general public in Manitoba is there. The thing is, you do have jurisdictions in North America who have moved to year-round daylight savings time, right? So like that extra hour of summer daylight in the evening. And where they've done that, they've quickly moved back, because I think everyone feels good about the summer, and then you get to December and the sun doesn't rise till 9:30 in the morning. So while people may want us to go and, well, first of all, I'd say this. There's a health benefit to us ending the time change either way. It's just if we go to standard time, it's more closely aligned with the circadian rhythm of the average person out there. So I just want to take some time to talk to Manitobans and see if we can build a consensus. But in terms of the broader question of why are we doing this, I think it's time for us to move past the time changes. And the question is just, do we want to go for the maximum health benefit, or is there potentially a public good argument to be made around a little bit of health benefit, but maybe a little bit of summer fun along the way too?
So you mentioned going to Manitoba. What does that look like?
Well, I think consultation in the first instance, and then we'll just kind of take it from there.
But are you planning like something formal, like Engage MB?
Yeah, we're working on an Engage MB type of survey, and we'll see where that goes. And then beyond that, we'll have, further conversation.
Did your stance change looking at this after BC?
Well, I think it just, First of all, my wife told me that this is stupid, that we're changing the clocks, right? So if anybody wants us to get away from time changes, you can thank Dr. Lisa Monkman and her professional advice, or maybe personal advice. So on a more serious level, you know, I understand what BC did, right? Like going to that extra hour of evening daylight in the summer is popular. But the reason why I'm not rushing to that is I want us to carefully consider kids going to school in the dark in wintertime. And I want us to carefully consider reducing obesity and stroke in our society. You look at the provincial healthcare system, if we bend the curve in either of those areas, that could be very, very helpful for our overall goals to have a healthy Manitoba. So again, as a politician, you kind of want to play to the crowd and give the people what they want, but at the same time, maybe spending a bit of time trying to nudge the conversation towards greater health benefits might help all of us be more happy and healthy in the long run.
I guess you already know that a lot of Manitobans don't necessarily like losing that hour of sunlight in the summer.
Until you get to December and the sun doesn't rise until 9:30 a.m., right? And as I said, other jurisdictions in North America have tried that change, and due to basically public opinion turning in the winter, they walked it back and returned to twice annual time change. So I think what I'm saying is the public opinion is in one place right now, probably, and I think it's worth a little bit of effort to try and see if a more sustainable solution to getting rid of these time changes, which I think everyone agrees is unhealthy, if we could move that into a place that people would be more consistent with. Like, we live in Winnipeg, right? Like, winter defines a big chunk of our existence. So I think getting the daylight question right in wintertime is pretty important.
Could you do it without other provinces or states?
Yeah. Well,
You're not afraid of doing it, going at it on.
No, like, so I was talking about this hockey practice. I was on the ice with somebody who grew up in Saskatchewan. And I even felt silly asking the question, like, was it weird growing up with no time change, right? Like, it doesn't even make sense. Like, if you grow up with no time change, then you don't know any different, right? And then if you grew up with the time change, all of a sudden it's like Liberation Day, right? So it's just... Nobody would design the system this way if we were starting from scratch today. The challenge just comes from us trying to transition away from this sleep-destroying structure that we currently have and trying to get it to something that's more healthy and sustainable for the public in the long run. So appreciate everyone who's flooded our inboxes as MLAs with their opinions on this. I can tell you there is a lot of people who have views on the old clock changes.
I have a question for you.
Yeah, sure.
Minister, have you seen the investigations into both Winnipeg Buchel sites that was published online just recently?
I'm sorry, I missed the first part of your question, Carol.
The investigation reports that have just been published online about the Griffles plasma collection centers findings, and it said that they passed their most recent inspection overall, but there were concerns, deficiencies of staff qualifications, cleaning of or maintenance of equipment, and investigations and the corrections of errors made into issues at the site. Were you aware of this, or does this concern you?
Yeah, obviously that's concerning information. You know, Health Canada is responsible for licensing that facility and that site, so they have a responsibility and obligation to make sure that they're meeting certain standards to maintain that licensing. Obviously, this is a topic of conversation now because 2 Manitobans have passed away and there's a current investigation underway. And so what we're waiting for is for that Health Canada investigation to be completed. We have officials here in Manitoba, including the Chief Medical Examiner, who's participating fully in that. And we'll wait for those findings to come in and make some decisions subsequent to that.
Manitoba Health Coalition asked me today for an inquest into the deaths of the paid plasma donors. What do you think about it?
I think that the Manitoba Health Coalition, you know, they're an organization that advocates for healthcare across this province. Had a meeting actually very recently with them that was very productive. I would say that, you know, anytime Manitobans pass away in a circumstance like this, it's tragic. We have 2 families that are grieving the loss of their loved ones. And so the number one priority is making sure that these families have the answers that they need and deserve, that they have full clarity on what has happened to their loved ones. Health Canada is undertaking, obviously, a very comprehensive and thorough investigation. We will await the findings of that investigation to make some decisions about what we'll do at the provincial level. I think it's really, really important for us to get full clarity on that investigation and then go from there.
Not committing to an inquest.
It's really important that we allow Health Canada to do their due diligence. That process is really important. We are going to participate fully if there are any additional ways that we can support this. And again, first and foremost, the families who are affected by these two Manitobans who had tragically passed away. We're going to do everything we can to make sure that the families have all the answers that they need and deserve here. And that, if there are additional steps that need to be taken at the provincial level, we will absolutely do that. There are many options on the table that we will explore once we have all of the investigation results.
Can I just do a quick technical addition on that last point? It's actually the chief medical examiner who would call an inquest. It's not a
That's correct. Thank you, Premier.
Yeah. So it would be Dr. Yoon's decision to do so or not.
Thank you, Premier.
What's the benefit of using a model in the province?
That's a good question. I mean, that's a question that has been active for a number of years, actually. We know that Manitobans are a very giving community, right? This is a province where folks want to find ways to support their neighbors, support their fellow community members, and donating is part of the way that Manitobans step up to do just that. So whether it's donating blood or donating plasma, Manitobans time and time again show that they want to make a difference in the health outcomes of those around them. We know that donating blood, donating plasma does save lives. We know that it is an overwhelmingly safe process to go to, or to do rather. These deaths are incredibly concerning. It's shocking and tragic whenever someone passes away, but certainly under these particular circumstances, it is incredibly important that we have a full understanding of what has happened, that we get the families the clarity that they need, and that Manitobans can understand that if they make the decision to donate plasma, they can do that with eyes fully wide open. They should know that it's going to be completely or as safe as possible. They should know all of the information, education they need to make the most informed decision to make a decision that ultimately does save lives. This is a structure that, again, is licensed by Health Canada. So this particular company and the way that these companies operate are licensed at the federal level. But again, we're going to wait to hear the findings from the investigation and then see what steps that we need to take at the provincial level after that's concluded.
Are there concerns that if we take the paid option away, that there would be a plasma donation just on a voluntary basis?
I think, Manitobans are, again, very giving, very generous, very charitable people. Manitobans always step up and find ways to help their neighbors. That's the spirit of Manitoba, and it's what makes our province such a beautiful place to live. It's important for us as a government, and certainly me in this role, to always put the wellness and the safety of communities first. So Manitoban safety, Manitobans' wellness will always be our top priority, and the decisions that we will make moving forward are going to have that be top of mind. We will always find ways to work with our partners to ensure that plasma supply, blood supply, is as available to Manitobans as it can possibly be. We want to see more Manitobans donate. We want to see more Manitobans give that gift of saving a life to their neighbors in this province. So we're always going to, again, prioritize Manitoban safety and well-being, and always make sure that we're doing our part so that these services are available and meeting the needs of many Manitobans who depend on blood and plasma for their well-being.
We talked to Manitobans who depend on being able to get money for their plasma to pay for their truck insurance or their vehicle payments, that this is really crucial to them when they're worried that the province might say no to allowing paid donations.
Yeah, what I would say to those folks is, first of all, thank you for donating, right? Again, making the decision, regardless of how you're making that decision to donate, it does save lives. And we know that there are many Manitobans of all ages who depend on plasma, who depend on blood, who depend on tissues to be donated. And so, I always encourage Manitobans to get as much information as you possibly can. Make sure you're fully informed. What goes into making that decision. so you can, take as much care as you need in making that choice. It's a big step to take, and we encourage Manitobans to do that. Also recognize that our top priority is making sure that Manitobans are safe, that they are protected. And so when a situation like this takes place, which no one ever wants to see deaths that may be related to donating plasma, right? We're waiting for the findings of the investigation to tell us exactly what's gone on here. It's important for us to do our own due diligence and make sure that if these structures are going to exist in Manitoba, that they are prioritizing public safety first and foremost. And if we do need to make a change, we are going to make the change in the most responsible way that prioritizes public safety and takes into consideration, of course, the impacts on Manitobans who do make those choices.
Have you spoken to anyone from that country?
No, I haven't directly.
Can you put in Zoom?
Let's go to Zoom.
Thank you, Minister. One reporter on Zoom from the Globe and Mail, Timur Durrani. Timur, one question, one follow-up. Go ahead.
Hi, thank you so much, Premier and ministers and other officials all here for taking our questions today. Premier Kinew and Minister Asagwara, I'm going to turn your attention again to these deaths that we're talking about of the two people who donated plasma at the for-profit sites in Winnipeg. My first question is, do either of you have any reason to believe these two people are not the only donors who have died after visits to Griffel sites in Winnipeg?
Thank you for the question. There's a responsibility when there's a death that it's reported to Health Canada, and Health Canada has the responsibility to report that to the province. So these are the two incidents, the two deaths that have been reported to us.
Okay. I ask this because, of course, part of a lot of this is based on voluntary vetting, right? And voluntary information, which also, of course, happens in the healthcare infrastructure. But a doctor will verify when a patient tells them something and they come into the hospital and they don't know something to the best of their knowledge that they may have as they come into an ER and things like that, as we're talking to doctors here today. But in Griffel sites, we have been told by donors that that is a voluntary thing, and they don't necessarily verify when they tell them something about their status or something that they don't know about. Of course, these are vulnerable groups who don't necessarily know those answers anyway and are being paid for something like this. So I ask, for you as well, who in your opinion do you think holds the responsibility of the vetting procedures there? Do you think Griffels needs to do more appropriate procedures in order to make sure that these donors are being taken care of before and after they donate plasma?
I think that your question is probably best directed to Health Canada, who is responsible for licensing that facility and that company and how they practice. Certainly, our expectation and my expectation in this role is that the number one priority is that Manitobans who access this service in this site, that their safety and their wellness is, of course, the top priority. It should be the top priority of the business, should be the top priority of Health Canada in terms of how these services exist and function. And certainly that is always our top priority as a government. So yes, of course, I think as a government, we've always been clear that Manitobans should have all the information, education they need to make the most informed health decisions for themselves. And, the expectation, of course, would be that Health Canada, who was responsible for licensing them, would do their due diligence and make sure that all steps are being taken to ensure that people are protected and that information and awareness is fully provided.
Thank you, Minister. That's it from Zoom. We'll turn it back to the room.
Premier Kinew, I'll also ask you to just speak in French at the end.
Okay.
Yep. Just on the deficit, the smallest.
I said the best, but yeah, same. Yeah.
Saskatchewan is forecasted to surplus. They're not projecting a deficit. There's talk that they could be the lowest. Are you saying that we are going to be lower than the 1.6 that has been projected?
Oh yeah, quite a bit. Yeah. Great ministers doing great work. Amazing people in the healthcare system, doing a lot with the investments that we've made, and a really strong economy that has a ton of great people going to work each and every day. The other answer is a lot more boring than that, which is that expenditures are rising more slowly than the economy is growing.
Is transfer payments helping us lower this number?
Everything helps. I mean, Manitobans wake up, put their name on the side of a truck, and go to work. I mean, that's basically the fundamental driver of the economy. You look at what's going on in other provinces right now. Trump is having an impact. He's having an impact here too. So we need to build Churchill. That'll unlock, potentially tens of billions of dollars in private sector investment, which would just take Manitoba's economy to the next level. So, yeah, I think part of what we want to do as a province is to be fiscally responsible. We have a responsibility to healthcare staff, to patients, to ensure that there's the necessary investments for this system to be sustainable. And as a result, we got to make sure that we're being good with your resources as a taxpayer, so we can pay for healthcare services going forward into the future.
Do you think our deficit's lowered us this
I think we're you can maybe go to Prince Edward Island and compare them to us. You'll have to see on March 24th. Check. He didn't ask me the actual number of the deficit. Okay, we'll do the French answers. Okay. Alors, c'est très important d'avoir des chirurgies ici au hôpital de Concordia parce qu'on a vu la réalité des patients qui ont vu une vie améliorée avec les médecins puis les infirmières qui sont si confiants d'un avenir avec un système de santé amélioré. Alors, en tant que votre gouvernement provincial, nous devrions continuer ces investissements parce que c'est un investissement dans l'avenir. Merci beaucoup. Oh, I think we're just finished.
On to the demonstration.